CAQH is a nonprofit organization with a mission to streamline business processes in healthcare, and CAQH Core is an initiative of CAQH. There are about 140 organizations that participate with CAQH Core to develop the operating rules. It started as a voluntary initiative back in 2005, and then in 2010, the Affordable Care Act mandated the concept of operating rules, and CAQH Core was designated by the Secretary of Health and Human Services as the operating rule authoring entity for the operating rules in the Affordable Care Act. The purpose of operating rules is to build on the HIPAA-mandated transactions for eligibility, claim status, EFT, ERA, prior auth, and claims, really that impact providers. The original HIPAA legislation from back in the late 90s, the goal of that was to enable providers and health plans to automate these processes through the use of the transactions. But over time, it was discovered that plans were using these transactions in different ways. So the purpose of operating rules is to build on the existing standards so that health plans are using the transactions in exactly the same way, so that a provider working with 10 different health plans has the same experience with each health plan and can then automate their systems. Operating rules are really good news for providers. Much of the heavy lifting in terms of requirements and implementations falls on the health plans and the clearinghouses, and the benefits really succumb to the providers. For example, with the eligibility transaction, providers are now receiving patient financial information like copay, deductible, coinsurance in real time, and that's all as a result of the operating rules. One of the ways providers can make sure that they're receiving the benefits of the operating rules is by talking to their practice management vendors. It's really important that every organization in the chain of the transaction, so in anyone that touches the transaction between the health plan and the provider, is following the operating rules, and practice management systems are key to that. So I would encourage providers to reach out to their practice management vendors, ask if they're in compliance with the Affordable Care Act mandated operating rules for eligibility, claim status, EFT, and ERA. Another great way to determine if your organization is in compliance or if a vendor is in compliance is through voluntary core certification. We offer it independent testing for compliance with the operating rules, and all the core certified entities are listed on our website.